First, I just want to say that UW Medicine is committed to the confidentiality of our patients and protecting their personal health information. We're also committed to compliance with HIPAA legal requirements on how we handle patient health information. As part of our trust with our patients, we are also committed to letting them know when errors occur while supporting them and answering any questions that they may have. On December 26, 2018, UW Medicine became aware of a database configuration error that allowed previously protected internal files to become available to the internet and discoverable by search via a browser. These files contain patient information about reporting that we and all healthcare systems are legally required to track when we share patient information. This was not a cyber attack, but rather this was an internal human error. Upon learning of the exposure, we took immediate action to remove the information from the site and worked with Google to remove any of the saved files. At this time, we have no evidence that this information has been misused. We are only aware of one confirmed patient who saw their information on the internet and initially made us aware. We sincerely apologize for any distress this may cause our patients and their families, and are in the process of notifying all affected patients. We have also reported this incident to the Office for Civil Rights. We've notified the media. We've posted information on a dedicated website and have a toll-free number for patients to call with additional information. We are required to report when patient information is shared to meet certain legal requirements. So examples of the types of information included in these files are reports of patient information for public health agencies and notification of certain conditions such as communicable diseases, reports to law enforcement or other protective services, and anytime a researcher receives approval to screen a patient's information for eligibility in a clinical study or to recruit patients for clinical studies. The information contained the name, the medical record number, again, not the medical record, but the internal number used to identify the patient within our system. It contained with whom the information was shared and a description of what was shared, such as demographics, office visits, or labs, but not the actual medical information or results. And the reason for the disclosure, for instance, was this mandatory reporting or screening for a study. It's also very important to highlight what was not included in these files. Again, these files did not contain medical records. They did not contain any financial information. They did not contain any Social Security numbers. Therefore, in the absence of the financial information and Social Security numbers, we believe the risk of identity theft is very low. Out of an abundance of caution, we are notifying all patients, including the majority of patients who had their name and medical record number exposed, even if little or no other actual healthcare information was contained in the files. And we're doing that because the name and the medical record number in and of themselves are considered protective health information. Again, we deeply regret any distress this may cause our patients and our families. In order to prevent this from happening again, we are reviewing our protocols and procedures and have engaged an outside organization to review our processes as well. At this point, I'd be happy to take any questions that you may have. We think the risk is extremely low for even medical issues with the medical record number. That medical record number is only used internally within our system. And anytime we care for a patient, we always require more than one source of identification verification, right? So we always ask for additional verification of who that individual is. So we believe that the risk from a medical perspective is also extremely low. And again, as you mentioned, the risk from an identity theft also we feel is really extremely low, given the fact that no financial information nor Social Security numbers were included in the information. We had a breach in 2013 that was very different from this. So again, this was based on human error around a database configuration. In 2013, we had a cyber attack, which this was not. But in 2013, we had a cyber attack, essentially a phishing email that an employee clicked on and introduced a virus into the system. That was a very different context, but there was an OCR investigation at that time as well. So we've had some experience with this, but again, completely separate causes and completely separate incidents.